These nurses feel like they ain't getting paid enough.
KTV's Amanda Quintana live in Oakland here. There is a strike materializing right behind you this morning, Amanda.
Yes, it started at 7 and they were ready at 7 o'clock. You can see people have a lot of different signs lined up here. This is Broadway here in Oakland. We've been hearing them do chants. You know, they've got bells, a lot of signs. They are calling this the unfair labor practice strike. Now, I was back here in October when this same group had a strike then. That one lasted 5 days. This one is open-ended, so we do not know how long it's going to last. Unions that are striking include the United Nurses Associations of California and the Union of Healthcare Professionals. They represent about 30,000 Kaiser employees across California and Hawaii, including registered nurses, lab professionals, nurse midwives, physical therapists, physician assistants, and more. They make up about 3% of Kaiser employees here in Northern California. They say there is a growing crisis caused by Kaiser's failure to invest in safe staffing levels, timely access to quality care, and fair wages for frontline workers. Kaiser says its hospitals, ERs, and nearly all medical offices will stay open during this strike, but some appointments might be shifted to virtual care. They do have employees ready to step in. Now,
So Kaiser Permanente nurses and employees are going on strike. We see this across the nation. There's another big strike, I believe, in New York for the nurses. These nurses feel like they ain't getting paid enough. They feel like they're not getting enough benefits. The big thing that's glaring to me about these nurse strikes is they're saying they're not getting the proper health insurance. How does a place like Kaiser that made $85.4 billion dollars in 2024 not give their employees that work in the healthcare industry the proper health care? That doesn't make sense. Why would you not give your employees and nurses insurance, the proper insurance that they can actually use? This makes no sense to me. These people are around so many diseases and blood and all that, and you're telling me they can't get the proper health insurance? Also, too, they said they were trying to cut down their pensions. Also, too, they've been threatened about their life insurance policies and taking that away. But Kaiser is saying they're going to give them, I believe, 30% more in pay, but that doesn't make sense if I'm going to have to get rid of all of these benefits that I have. So what we see is they're trying to put the money in front of them, but take things from the back. So that's the thing we kind of see with these nurses as far as like, you know, Kaiser has 31,000 nurses. The big thing that you have to understand is these nurses are in California and I believe Hawaii, where they're mainly protesting at.